Prostate cancer. It's a phrase that strikes fear into many, but knowledge is power. Understanding this disease is the first step in fighting back. The prostate. It's a small gland about the size of a walnut, found in men, nestled just below the bladder. It plays a crucial role in reproduction, producing fluid that nourishes and transports sperm. But this tiny gland can be the site of a significant health concern, prostate cancer. This occurs when cells in the prostate begin to grow uncontrollably. Join me, Dr. Mike, as we delve into the world of prostate cancer. Together, we'll learn about its causes, symptoms, and the range of treatment options available. Prostate cancer is incredibly common. It is the second most common cancer in men globally, impacting millions of lives. In the United States alone, 1 in 6 men will be diagnosed with prostate cancer in their lifetime. These are not just statistics. They represent fathers, brothers, sons, and friends. The good news? Prostate cancer also has a high survival rate, especially when detected early. This is why awareness and understanding are so vital. By learning about prostate cancer, we can empower ourselves and our loved ones to take charge of our health. This knowledge can make all the difference. Early detection is key when it comes to prostate cancer. In its early stages, prostate cancer often has no symptoms. This means regular checkups and screenings are crucial, especially for men over 50 or those with a family history of the disease. Don't put off your health. Talk to your doctor about prostate cancer screening. A simple blood test, called a PSA test, can detect early signs of the disease. Early detection dramatically increases the chances of successful treatment and survival. Your health is worth it. This comprehensive guide will equip you with the knowledge you need to understand prostate cancer. We will discuss risk factors, symptoms, and the latest advancements in treatment. From surgery to radiation, hormone therapy to chemotherapy, we'll explore the range of options available, empowering you to make informed decisions about your health. Remember, you are not alone in this journey. Millions of men and their families are facing prostate cancer. Together, we can break down the stigma, raise awareness, and advocate for better research and treatment options. Let's take the first step together. Knowledge is power, and together, we can fight back against prostate cancer. Unraveling the mystery. What causes prostate cancer? Prostate cancer, like many cancers, is a complex disease with no single identifiable cause. Instead, it arises from a combination of factors, some within our control and others beyond it. Think of it like a puzzle, where multiple pieces come together to form the complete picture. Understanding these pieces, these contributing factors, is crucial in unraveling the mystery of prostate cancer. Scientists have made significant strides in identifying some of these puzzle pieces, shedding light on what might increase a man's risk of developing this disease. These risk factors can range from age and genetics to lifestyle choices and environmental exposures. While we may not have all the answers yet, understanding these risk factors is a powerful tool. It allows us to make informed decisions about our health, potentially lowering our risk and empowering us to take a proactive approach towards prostate health. The aging factor. Time and your prostate. As men age, the prostate gland naturally undergoes changes. One such change is the increased likelihood of cells within the prostate multiplying abnormally, potentially leading to prostate cancer. Age is, in fact, the most significant risk factor for prostate cancer. The older a man gets, the higher his chances of developing the disease. This risk significantly increases after the age of 50. While we can't stop time, understanding this link between age and prostate cancer is crucial. It underscores the importance of regular checkups and screenings, especially for men over 50. Early detection is key when it comes to prostate cancer, and age is a critical factor in determining when those screenings should begin. Remember, early detection saves lives. Family ties, genetics, and inherited risk. Our genes hold the blueprints to our bodies, influencing everything from our hair color to our predisposition to certain diseases. Prostate cancer is no exception. Men with a family history of prostate cancer, particularly a father or brother diagnosed with the disease, have a higher risk of developing it themselves. This suggests that inherited gene mutations can play a role in increasing susceptibility. While we can't change our family history, knowing about this genetic link is vital. It allows men with a family history of prostate cancer to be more proactive about their health, opting for earlier and more frequent screenings. If you have a family history of prostate cancer, be sure to discuss this with your doctor. They can help assess your individual risk and recommend the most appropriate screening schedule for you. Section 4. Beyond genes, lifestyle choices, and environmental factors. While genetics plays a role, it's not the only factor influencing prostate cancer risk. Our lifestyle choices and the environment we live in also contribute to the intricate puzzle. Research suggests that maintaining a healthy weight through diet and exercise may lower the risk of developing aggressive prostate cancer. A diet rich in fruits, vegetables, and whole grains is particularly beneficial. Conversely, certain lifestyle factors such as smoking and excessive alcohol consumption have been linked to an increased risk of prostate cancer. Making healthy choices can significantly impact your overall health and potentially reduce your risk. Section 5. Racial disparities. Understanding the increased risk. Prostate cancer doesn't affect all populations equally. Sadly, African American men face a disproportionately higher risk of developing and dying from this disease compared to other racial groups. While the exact reasons for this disparity are complex and not fully understood, ongoing research points to a combination of genetic predisposition, socioeconomic factors, and potential differences in access to healthcare. Addressing these disparities is crucial in the fight against prostate cancer. It highlights the need for increased awareness, earlier screenings, and improved access to quality healthcare for all men, regardless of race or ethnicity. Section 1. Silent signals. Recognizing early symptoms. Prostate cancer can be a silent stalker. In its early stages, it often doesn't cause any noticeable symptoms. This makes it tricky to detect, but also highlights the importance of regular screenings. However, as the tumor grows, it can start to press on the urethra, the tube that carries urine from the bladder. This pressure can lead to various urinary problems, which are often the first noticeable signs of prostate cancer. It's important to remember that these urinary symptoms are not always a sign of cancer. They can be caused by other, less serious conditions like an enlarged prostate or a urinary tract infection. Nonetheless, any changes in your urinary habits should never be ignored, especially if you are over 50 or have other risk factors for prostate cancer. Early detection is key. Section 2. Urinary issues, when to pay attention. So, what kind of urinary issues should raise a red flag? Frequent urination, especially at night, is one of the most common early symptoms of prostate cancer. Difficulty starting or stopping urination, weak or interrupted urine flow, and a feeling of incomplete bladder emptying are other telltale signs. These symptoms can be frustrating and impact daily life. Pain or burning during urination can also occur, although this is less common in the early stages of prostate cancer. If you experience any of these symptoms, it's vital to consult your doctor. Don't hesitate to discuss your concerns, even if you think it might be nothing. Your doctor can help determine the cause of your symptoms and recommend the appropriate tests if necessary. Section 3. Beyond the bathroom. Symptoms that extend further. While urinary problems are often the first noticeable signs, prostate cancer can manifest in other ways as well. These symptoms usually occur in the later stages when the cancer has spread beyond the prostate gland. Blood in the urine or semen can be a sign of advanced prostate cancer. This can be alarming, but it's crucial to remember that blood in the urine can also have benign causes. Still, always seek medical attention. Bone pain, particularly in the back, hips, or pelvis, can occur if the cancer has spread to the bones. Unexplained weight loss, fatigue, and loss of appetite can also be signs of advanced disease. If you experience any of these symptoms, especially in conjunction with urinary problems, it's essential to seek immediate medical attention. Early detection and treatment can make a significant difference. Section 4, the PSA test, a powerful screening tool. Early detection is the best defense against prostate cancer, and the PSA test is a valuable tool in this fight. PSA stands for prostate-specific antigen, a protein produced by the prostate gland. A PSA test is a simple blood test that measures the level of PSA in your blood. Elevated PSA levels can be an early indicator of prostate cancer, although not always. Other factors, such as an enlarged prostate or inflammation, can also cause PSA levels to rise. That's why a PSA test alone is not a definitive diagnosis of cancer. If your PSA levels are high, your doctor may recommend further tests, such as a digital rectal exam or a biopsy, to confirm the presence of cancer. Don't wait for symptoms. The importance of proactive screening. Remember, prostate cancer often doesn't cause noticeable symptoms in its early stages. That's why regular screenings are so crucial, even if you feel perfectly healthy. The American Cancer Society recommends that men at average risk for prostate cancer begin discussing screening with their doctor at age 50. This conversation allows for personalized recommendations based on individual risk factors. Men at higher risk, such as African Americans or those with a family history of prostate cancer, may need to start screening earlier. Your doctor can help determine the right screening schedule for you. Early detection through regular screenings dramatically increases the chances of successful treatment and survival. Don't wait for symptoms to appear. Take charge of your health and talk to your doctor about prostate cancer screening. Your health, your priority. Talking to your doctor. Open communication with your doctor is crucial when it comes to prostate health. Don't be afraid to ask questions, express your concerns, and discuss your family history. Your doctor is your partner in health. They can provide personalized advice, recommend appropriate screenings, and address any anxieties you may have. Remember, knowledge is power. The more you know about prostate cancer, the better equipped you are to make informed decisions about your health. If you're experiencing any unusual symptoms, don't hesitate to seek medical attention. Early detection and treatment can make a world of difference. Your health is worth it. Navigating the options. Your prostate cancer treatment journey. Receiving a prostate cancer diagnosis can be overwhelming. Suddenly you're faced with a range of treatment options, each with its own set of benefits, risks, and potential side effects. Take a deep breath. You don't have to make any decisions overnight. This is a journey you'll navigate with your healthcare team, who will guide you every step of the way. The first step is understanding your individual case. The stage and grade of your cancer, your overall health, and your personal preferences will all factor into the treatment plan. Rest assured, there are many effective treatment options available. From surgery to radiation, hormone therapy to chemotherapy, we'll explore these options in detail, empowering you to make informed decisions about your health. Surgery for prostate cancer involves removing the prostate gland either partially or completely, depending on the extent of the cancer. This procedure is known as a prostatectomy. Prostatectomy is a common and effective treatment option, particularly for localized prostate cancer that hasn't spread beyond the gland. It offers the potential for a cure in many cases. However, like any surgery, prostatectomy carries potential risks and side effects. Urinary incontinence and erectile dysfunction are the most common concerns, although advancements in surgical techniques have significantly reduced their likelihood. Your surgeon will discuss these risks and benefits in detail, addressing your specific concerns and helping you determine if surgery is the right option for you. Radiation therapy utilizes high-energy rays to destroy cancer cells, either killing them outright or preventing them from multiplying. It's a common treatment for prostate cancer, often used after surgery or as a primary treatment option. There are two main types of radiation therapy: external beam radiation and brachytherapy. External beam radiation delivers radiation from a machine outside the body, while brachytherapy involves placing small radioactive seeds directly into the prostate gland. Radiation therapy, like any cancer treatment, can cause side effects, such as fatigue, skin irritation, and urinary problems. However, these side effects are usually temporary and manageable with proper care. Your radiation oncologist will carefully plan your treatment to target the cancer cells, precisely minimizing damage to surrounding healthy tissues and organs. Prostate cancer cells rely on testosterone, a male hormone, to grow and spread. Hormone therapy, also known as androgen deprivation therapy, aims to reduce testosterone levels or block its effects on cancer cells. This treatment can shrink tumors, slow cancer growth, and alleviate symptoms. Hormone therapy is often used in combination with other treatments, such as surgery or radiation, or as a palliative option to manage advanced prostate cancer. While generally effective, hormone therapy can cause side effects, including hot flashes, fatigue, loss of libido, and erectile dysfunction. These side effects vary depending on the specific hormones used and the duration of treatment. Your doctor will discuss the potential benefits and risks of hormone therapy, tailoring the treatment plan to your individual needs and monitoring you closely for any side effects. Section 5. Chemotherapy, a systemic approach to fighting cancer. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. It's a systemic treatment, meaning it targets cancer cells that may have spread beyond the prostate gland. Chemotherapy is typically used in advanced stages of prostate cancer or when other treatments haven't been successful. It can also be used to relieve symptoms and improve quality of life. Chemotherapy drugs are usually given intravenously, but some can be taken orally. Side effects are common and can include nausea, vomiting, hair loss, fatigue, and an increased risk of infection. Your oncologist will carefully monitor your response to chemotherapy, adjusting the dosage or treatment schedule as needed to manage side effects and optimize your outcome. Section 6. Weighing the options. A personalized decision with your doctor. Choosing the right treatment for prostate cancer is a deeply personal decision. There's no one-size-fits-all approach, as each case is unique. Your doctor will consider various factors when recommending a treatment plan, including the stage and grade of your cancer, your overall health, your life expectancy, and your personal preferences. It's essential to have open and honest conversations with your doctor, asking questions, expressing your concerns, and discussing your treatment goals. This shared decision-making process ensures you're comfortable with the chosen approach. Remember, you are not alone in this journey. Your healthcare team is there to support you every step of the way, providing expert guidance, emotional support, and compassionate care. Section 7. Clinical trials, advancing treatment, offering hope. Clinical trials are research studies that evaluate new and promising treatments for diseases like prostate cancer. They play a crucial role in advancing medical knowledge and improving patient outcomes. Participating in a clinical trial can provide access to cutting-edge treatments that are not yet widely available. It also contributes to scientific progress, helping future generations facing a prostate cancer diagnosis. Clinical trials are carefully designed to ensure patient safety and data integrity. Your doctor can help you explore clinical trial options that align with your specific case and treatment goals. If you're interested in learning more about clinical trials, talk to your doctor or visit reputable websites like clinicaltrials.gov, a comprehensive resource maintained by the National Institutes of Health. Prevention on your plate, the power of a healthy diet. While we can't completely eliminate the risk of prostate cancer, we can make lifestyle choices that significantly reduce our chances of developing this disease. And it all starts with what we put on our plates. A healthy diet is like a suit of armor, protecting our bodies from within. When it comes to prostate health, a diet rich in fruits, vegetables, and whole grains is particularly beneficial. These foods are packed with antioxidants, vitamins, and minerals that help fight inflammation, boost the immune system, and protect cells from damage caused by free radicals. Think of them as your body's internal defense team. On the other hand, diets high in processed meats, saturated fats, and sugary drinks have been linked to an increased risk of prostate cancer. These foods can fuel inflammation and create an environment within the body that's conducive to cancer cell growth. Stay active, stay healthy. Exercise and prostate health. Maintaining a healthy weight through regular exercise is another crucial aspect of prostate cancer prevention. Physical activity is like a tonic for our bodies, boosting overall health and reducing the risk of numerous diseases, including prostate cancer. Studies have shown that men who engage in regular exercise have a lower risk of developing aggressive prostate cancer. Exercise helps regulate hormone levels, boost the immune system, and maintain a healthy weight, all factors that contribute to prostate health. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be brisk walking, jogging, swimming, cycling, or any activity that gets your heart rate up and makes you break a sweat. Remember, even small amounts of physical activity are beneficial. Find activities you enjoy and make them a part of your daily routine. Your prostate will thank you for it. Know your numbers. Regular checkups as your shield. Think of regular medical checkups as your shield, protecting you from the silent threat of prostate cancer. Even if you feel perfectly healthy, regular checkups are crucial for early detection and timely intervention. During these checkups, your doctor will monitor your overall health, assess your risk factors for prostate cancer, and recommend appropriate screenings based on your individual needs. These visits are also an opportunity to have open and honest conversations with your doctor about any concerns you may have regarding prostate health. Don't hesitate to ask questions, express your anxieties, and seek clarification on any aspect of your health. Remember, early detection is key when it comes to prostate cancer. Regular checkups provide the best chance of catching the disease in its early, most treatable stages. Early detection, better outcomes. The importance of screening. Screening tests play a vital role in the fight against prostate cancer. These tests are designed to detect the disease in its early stages, even before symptoms appear, when treatment is most effective. The most common screening test for prostate cancer is the PSA test, a simple blood test that measures the level of prostate-specific antigen, or PSA, in your blood. Elevated PSA levels can be an early indicator of prostate cancer. However, it's important to remember that a PSA test alone cannot diagnose prostate cancer. Other factors, such as an enlarged prostate or inflammation, can also cause PSA levels to rise. If your PSA test results are abnormal, your doctor may recommend further tests, such as a digital rectal exam or a biopsy, to confirm the diagnosis. A holistic approach, lifestyle choices for long-term well-being. Protecting your prostate health isn't just about individual actions, it's about adopting a holistic approach to well-being. It's about making sustainable lifestyle choices that support your overall health and reduce your risk of developing not just prostate cancer, but other chronic diseases as well. This means nourishing your body with a balanced diet, staying physically active, managing stress through relaxation techniques like meditation or yoga, and getting enough sleep. It also means making responsible choices when it comes to alcohol consumption and avoiding smoking altogether. These substances can wreak havoc on your body, increasing your risk of various cancers, including prostate cancer. Remember, your health is your most valuable asset. By making conscious, informed choices today, you're investing in a healthier, brighter future for yourself and your loved ones. John's story, facing fear with courage. John, a vibrant 62-year-old grandfather, received the life-altering news of a prostate cancer diagnosis. The news hit him like a ton of bricks, conjuring fear and uncertainty. Would he need surgery? Radiation? What about side effects? Would he still enjoy his favorite activities and family time? Despite the fear, John faced his diagnosis with remarkable courage. He leaned on his support system, his wife, children, and close friends. His doctor explained treatment options and outlined a personalized plan. John's treatment journey wasn't easy. He underwent surgery and faced a challenging recovery. But he never lost sight of his goals, to regain his health and embrace every moment with his loved ones. John's story is a testament to the power of the human spirit to overcome adversity. Today, John is cancer-free, enjoying life to the fullest and cherishing every moment with his family. Mark, a dedicated teacher and passionate cyclist, was at the peak of his physical fitness when he received a prostate cancer diagnosis at 55. The news shook his world. Cycling was his passion, his stress reliever, his connection to nature. The thought of cancer sidelining him filled him with dread. Determined, Mark approached his treatment with tenacity. He endured radiation therapy with resilience. His cycling community offered strength and encouragement. With each pedal stroke, Mark felt his strength returning. Today, Mark is back on his bike, inspiring others with his story. He's a testament to resilience and the power of community. David, a retired lawyer and prostate cancer survivor, became a tireless advocate for awareness, early detection, and improved treatment options. He realized many men lacked access to reliable information and support services. David used his voice and legal expertise to make a difference. He became a familiar face at health fairs, community events, and legislative hearings. He founded a support group for survivors and their families. David's advocacy extended to national organizations lobbying for better policies. His story inspires us to use our voices and advocate for change. We've covered a lot of ground in this comprehensive guide to understanding prostate cancer, from the basics of the prostate gland to the complexities of diagnosis, treatment, and life after cancer. But the most important takeaway is this: your health is in your hands. You are the CEO of your own body. Empower yourself with knowledge, make informed decisions, and take an active role in your prostate health. Don't be afraid to ask questions, seek second opinions, and advocate for your well-being. Remember, you are not defined by a diagnosis. Whether you're a man concerned about his risk, a newly diagnosed patient navigating treatment options, or a survivor embracing life after cancer, remember that you have the strength and resilience to face whatever challenges lie ahead. Take charge of your health, be informed, be proactive, and most importantly, never lose hope. Your journey is unique, and you have the power to shape its course. Knowledge is power, spreading awareness, breaking the silence. Prostate cancer thrives in silence. For too long, men have been hesitant to talk about their health, particularly when it comes to sensitive topics like prostate cancer. But silence only serves to perpetuate fear and stigma. We need to break the silence. Talk to your friends, family members, and colleagues about prostate cancer. Share this video, this information, and your own experiences to help raise awareness. Knowledge is power, and the more we talk about prostate cancer, the more we normalize it, encourage early detection, and create a supportive environment for men facing this disease. By shining a light on prostate cancer, we can empower men to take control of their health, seek timely medical attention, and access the support they need. Let's break the silence together and create a future where prostate cancer is no longer a taboo subject. Early detection, best defense, regular checkups, timely screenings. Time and time again, we've emphasized the importance of early detection in the fight against prostate cancer. When caught in its early stages, prostate cancer is highly treatable, with a high survival rate. Don't wait for symptoms to appear. Make regular checkups with your doctor a non-negotiable part of your health routine. Discuss your risk factors. Ask about screening options like the PSA test, and follow your doctor's recommendations. These simple steps can make a world of difference. Early detection gives you the best chance of successful treatment and a long, healthy life. Don't delay. Schedule that checkup today. Support systems and shared journeys, you are not alone. Facing a prostate cancer diagnosis can be daunting, but it's crucial to remember that you are not alone on this journey. Millions of men and their families have walked this path before you, and their experiences offer invaluable insights and support. Connect with others who understand what you're going through. Join a support group, either online or in person, where you can share experiences, exchange information, and find strength in community. Talk to your loved ones. Let them know how they can support you, whether it's accompanying you to appointments, lending a listening ear, or simply being there with a comforting presence. Remember, sharing your journey lightens the load. Surround yourself with a supportive network, and you'll find the strength to navigate the challenges ahead. Investing in hope, research, advocacy, and a brighter future. The fight against prostate cancer is a marathon, not a sprint. While we've made significant strides in understanding, diagnosing, and treating this disease, there's still much work to be done. Research is our greatest weapon. Scientists are working tirelessly to develop new and more effective treatments, from targeted therapies to immunotherapies that offer fewer side effects and better outcomes for patients. Support organizations dedicated to prostate cancer research and advocacy. These organizations play a crucial role in funding groundbreaking research, raising awareness, and advocating for policies that improve patient care and access to treatment. Together, we can invest in hope. By supporting research, raising awareness, and advocating for change, we can create a brighter future for men facing prostate cancer, a future where this disease is no longer a